Okay, to prepare for birth, it is important to know that there are no single maternal positions that are um, like acceptable or whatever. There's all kinds of different positions that moms can take. It could be side lying, squatting on all fours, using lots of pillows. Uh, all of them need to have some kind of a bearing down effort. We call that a Valsalva maneuver, where you intentionally like bear down. And we coach to hold their breath for and push for 10 seconds. But the problem with that one is it can lead to fetal hypoxia. So we are watching very closely on a monitor to see what that fetal heart rate is doing. Spontaneous pushing efforts, just mom pushes when she feels the need to push. They both kind of work together, and I feel like doctors use them both in different ways. So it just depends on what the situation is, what the mom is looking for, and how the doctor kind of wants to go about it. Crowning occurs when the widest part of the head descends into the vulva just before birth. It is also known as like the ring of fire. If you've ever heard that, it can be extremely painful. It doesn't even matter if you have an epidural in. An episiotomy is an incision on the perineum to widen the vaginal outlet. So there's a lot of controversy on episiotomies. So some believe that where the body naturally tears is where the weakest part is, and that it's going to heal the greatest. Some believe that those jagged tears, because it's not usually a clean tear when that happens, are more harmful, harder to heal, and they would rather sew up something, but then at the same time, you don't really know where you're slicing it. You could slice a very important nerve. So there's a lot of controversy with that. Fundal pressure, this is where the nurse applies pressure on the uterus to assist with birth. Like they get right up on the mom, on the belly, and push down as mom is pushing and doctor is pulling baby out. We don't want to use that in cases of shoulder dystocia where the shoulders are really stuck. Mechanisms of labor, just knowing that there's 7 cardinal movements of baby descending in and through the pelvis and on its way out. There are powers of labor. The primary powers are the involuntary contractions, and then these are responsible for effacement and dilation. And then the secondary powers are when the mom gets the urge to like really push. Factors affecting labor: fetal presentation, which is the part of the fetus that is coming out first. Cephalic, which is the head, is 96% of all births. Breech can be buttocks, feet, or both. First, that is 3% of births, and shoulder presentation is 1% of births. So these are all breech, except for this one is a shoulder presentation. Leopold maneuvers, this is how we kind of figure out what position baby is in. So it's a matter of finding the baby's sides by feeling the side of the belly, and then locating where the head is. The head is going to be a softer, rounder, and then finding the back and the rump of the baby. We also look at the presenting part in terms of the position of mom. So we start with the right or left side of the maternal pelvis. So whichever way the head is facing is whichever direction we call it. So if you see how baby's presenting part, the lowest part is on mom's right side of the pelvis, that's how we get right. If it's the baby's head is on the left side of the pelvis, then we get left. And then it's the presenting part. So the O is occiput, which is the head. S is sacrum, which would be the back. Chin, or even scapula. And then presenting part in relation to the pelvis. So A would be anterior. So the more presenting part towards the anterior of mom's pelvis. Posterior would be the most presenting part on the posterior side of mom's pelvis, and transverse, meaning that it's kind of just sideways, that it's right on, it's not really posterior, anterior, it's right in the middle. Okay, we also have the station. I know I talked about this in that lab. So we have minus, which is going further up into the birth canal, and then positive, which is on its way out of the birth canal. We look at that in relation to the ischial spine. Station 0 is also known as the point of engagement. Okay, here's another picture that shows the cervical changes during labor, how the cervix shortens. and thins out. You can see it thinning out here until the edges are pretty much gone of the cervix. Perineal lacerations, so these are usually going to be tears. We have 1 through 4 degrees. First degree is usually going to be very minor, and fourth degree is very much serious, affecting like into the rectal wall kind of thing. Monitor for lengthening of cord to indicate the placenta is on its way out. We're going to monitor for blood loss and administer Pitocin if needed. Stages of labor, the third stage is the birth of the placenta. So this needs to separate from the uterus and then come out of the birth canal. Sometimes moms don't have to push it all, like it just kind of comes out, and some moms do actually have to kind of push it out. Fourth stage of labor lasts approximately 2 hours after the delivery of the placenta. It's when homeostasis is reestablished and the parent-child bonding attachment begins. We want to monitor for abnormal bleeding in this period, and and hopefully bonding is occurring in this stage. There's also a major fluid shift that happens because of hormones after birth, so it's not uncommon for moms to need to go to the bathroom more often to urinate. And then you see like blood pressures, they might start going down, the need for insulin if they are gestational diabetic going down as well. And that concludes Unit 1.